Welcome to Long-Term Care Policy and Management. This is Public Health 627.
This is your Week 5 video.
So let's start with what is an assisted living? An assisted living facility, which sometimes we just call an AL, is a nursing home light. Generally, it's a lower level of care than a nursing home or a skilled nursing home setting. Now, one of the things that can be confusing is that some people use residential care and assisted living interchangeably. Generally, they mean the same thing. They usually provide ADLs, food, and med management. We tend to use the term residents when talking about assisted living consumers, just like we did with nursing homes. So what's the difference between a nursing home and an assisted living? Well, there's different payment sources. So it's always private pay or Medicaid. There's absolutely no Medicare in assisted living. Some long-term care insurances will pay for an assisted living, but that's becoming quite a bit rarer than it used to be. The staffing is usually much less than what a nursing home provides. The patient population or the residents are usually healthier and more mobile than nursing home residents. The facilities are less regulated, so a lot of times nursing homes will look all the same. These facilities will look very different. Assisted living can be within a complex with a skilled nursing unit and a nursing unit. So just like it was confusing which bed was where, you can also have an assisted living within the same building. But because they have really different staffing requirements and they usually provide different assistance, it's going to be a set-aside wing or floor of a multi-tiered facility. So if you have a big facility that has skilled nursing, assisted living, and nursing, your assisted living is probably going to be separated either by a floor or a wing or a unit or something. So what's the difference between an assisted living and a residential care? The author goes over this a little bit in the text. I don't want you to get stuck in the weeds in this. Basically, residential care and assisted living might be the same thing, or it might be a different thing. Some states don't use the assisted living term at all. Some use residential care instead. Some states consider assisted living kind of a higher level of care, and a residential care is slightly a lower level of care. Some states, a residential care means more of a home-based facility. So you can see in one of the videos, they think of assisted living as like 100 or more beds, and residential care is kind of like small 0 to 10 beds in someone's home. I think for our purposes, I really don't want you to go too deep with this. All the states can really treat it differently. So think of assisted living as basically the larger model, and residential care is the smaller model, but basically the same thing. So Medicaid might pay for assisted living. Assisted living is mostly private pay. A lot is paid for by Medicaid, but it's paid for usually under a community-based waiver because these assisted livings are considered living at home. This is important because the same pile of money that is used for nursing home is not used for assisted living. And I'm talking about the Medicaid dollars. Now, obviously, Medicaid prefers assisted living if the resident can go to assisted living because this is a cheaper option than nursing. Underlying this, it's not really a discussion that we're going to have right now, but there have been arguments made that because assisted living isn't really a medical model, that Medicaid should not pay for it. But at this point, they do. Medicaid pays for a semi-private room. So assisted livings that take Medicaid will often look much like a nursing home. Medicaid does not pay for the type of assisted living that has like an efficiency apartment with a little kitchenette that looks a lot like a fancy hotel room. Rooms are shared that are paid for by Medicaid. So as I said, generally assisted livings are going to be less expensive than nursing facilities, much less expensive than skilled nursing facilities. But not necessarily. I mean, you can have some assisted livings in this country that are on the ocean side that provide many activities that have all these benefits that are built in. Those can be really expensive, maybe even more than nursing homes. So while nursing facilities might range around the $300 to $400 a day mark, assisted livings can be somewhere around the $100 to $300 a day mark. Long-term insurance might pay, as we said before, but this is growing more and more unlikely. Transitioning from a nursing home to an assisted living or res care is another really confusing part of long-term care for consumers. If a resident is in a nursing facility and slowly improves over time, they might get transferred to an assisted living bed because they need less care, so they don't need to be in the nursing home. What this does is it's another insurance change because, as we know, the assisted living money is not the same pot of money as the nursing facility money. So again, many residents in assisted living don't understand what changed, just that there's a lot of paperwork to sign. So this is very similar to when consumers go from a skilled nursing home bed into a regular nursing home bed. Sometimes it doesn't look like a lot's changed, and the biggest thing that the resident sees is all this paperwork that has to be signed. But in fact, there has been a big change. Another thing about assisted livings is there can be a lot of back and forth. If a consumer is in a nursing home and improves, they can get transferred to an assisted living bed. But if they decline in the assisted living, or were doing well in the previous setting and the move made them do worse, then they may need a nursing facility again. This happens to a lot of people. The problem is we have residents who bounce back and forth if they're really on that line between assisted living and nursing home level. Another problem is there's no guarantee that once they've left the nursing home is going to take them back. They have no obligation to. Part of this is assisted living really is controlled by the states. Federal government doesn't participate that much, not like nursing homes. So you have a lot of variation from state to state. And since it's paid for by Medicaid, which is the state insurance, and private sources, there's not a lot to hold over the head of these facilities to say you have to do this. There is some regulation and there is some federal oversight. However, states really have created all the rules and regulations themselves. So if you go from one state to another, the assisted living or residential care rules could look really different. I will say that states, when they do create rules and regulations, often try to model these after the nursing home rules. So sometimes you will have some similarity once you go from one state to the other. But some states are really different. They're far ahead or way far behind and look really different. Just like nursing homes, there are some assisted living specialty units. Many of these are dementia specialty units. They create secured spaces. So these are for really residents with very healthy bodies that can roam and explore, but the facility needs to be secure, which means there's no way to wander away or get out. Usually these type of assisted livings are much more expensive. They do tend to have higher staffing ratios and specialized training for staff to deal with dementia and Alzheimer's. So that's it for week 5. I gave you a couple of extra videos to check out. They're really short, just a couple of minutes apiece, of different kind of simplified explanations of what assisted living is. So if you have time, check those out too. As always, I'm here for your questions, comments, and concerns. Have a great week 5.